The congressional delegation told the governor there needs to be more transparency in the distribution system. They raised concerns about the rechanneling of vaccines to other partnerships and the lower rates of vaccinations for communities of colors that absolutely must be addressed. How will the state-run sites, retail pharmacies, hospitals, health systems, clinics, the mass vaccination sites, how will they coordinate with our local health departments to ensure that there is equitable distribution at these particular mass vaccination sites, as well as the partnerships within our private providers? We have been very intentional here in our county in ensuring within our allotment that we set aside vaccines to those zip codes that have been most disproportionately impacted. And there obviously has been a challenge with the consolidation of the registration system. How is the state taking into account those equitable issues? And I know, although the two locations are located in Prince George's and located in Baltimore, which clearly have very robust minority communities, as we know, Montgomery County also has a very racially robust community. So how are you taking in equity into the mass vaccination sites that have been set up and the partnerships with the private providers?
So thank you, Councilman Albornoz, for that question. So, the retail pharmacy program is, we're starting out in a limited fashion. And this is a federal program, actually, that we expanded to a couple of weeks ago to be able to provide some initial doses. Again, this is part of our longer range strategy to begin to establish that foundation of vaccine and vaccination capacity throughout the state. And so we did look at equity in terms of geographic distribution around the state of these locations, but also I will say in terms of the selection of the initial sites for retail locations, we did look at where COVID-19 has impacted communities the most, as well as racial and socioeconomic status within specific zip codes and such, and use that to help guide some of the initial selections. We are also working very closely with each of the retail pharmacy partners. And as I spoke with Dr. Gales last week, and each of the retail pharmacy locations that have been identified have been very willing to work with local partners to assist not only in the vaccination at their retail pharmacy site, but also to actually provide some assistance with vaccinating specific populations, target groups in perhaps some facilities or congregate living settings. And so that's a local partnership and a local conversation that we are very happy to facilitate. I believe Dr. Gales indicated that he had already some relationship with some of the pharmacies. And so again, that's very, very much possible. In addition, at our mass vaccination clinics, these are open to residents of any county. So while it is situated in Prince George's County, it's a location that we actually stood up, and I had I was very involved in the standing up of the Prince George's site back in June when we initially did testing, because it was accessible. The location was there, and we worked very closely with Six Flags. We have now morphed that into a vaccination site. And so we know that Montgomery County residents have access that location for vaccines and can continue to do so. We are working as well with Prince George's County Health Department happy to work with Montgomery County as well to identify individuals that to be vaccinated at that mass vaccination clinic as well.